Hi, thank you for watching our video. I'm Sarah McAllister and I'm an orthopedic physical therapist at Oregon Health and Science University. I've been a physical therapist here for almost 12 years now and have loved every minute of it. I got interested in physical therapy as a high schooler when I ran track and cross country and would get injured every season. With the help of physical therapists, I was able to keep running and finish the season. As I went off to college, I lost interest in physical therapy and looked into other careers. But when I was finishing my sophomore year of college, my father had a stroke that he went through physical therapy for over a year. His primary goal with physical therapy was to be able to go fishing again and get into a fishing boat. When he was able to do that, he was the happiest any of us had seen him in a long time, and that made me realize physical therapy was a career that I really did want to pursue. And then I returned back to the course of physical therapy and completed my bachelor's degree, got my doctorate degree, and have been here ever since. It's been a wonderful job to work in, and I absolutely love seeing my patients reach their goals of getting back to the activities, hobbies, and work that they enjoy doing. Perfect. So the following videos are some of the equipment and technology that we have in our clinic that we get to use with our patient in order to complete assessments and help them train and then assess their readiness for return to sports and activities. So please enjoy these following videos. All right, so I'm Sarah, I'm a physical therapist at OHSU, and this is Allie, another therapist, and we're going to show you the Alter G treadmill today, which Alter G stands for anti-gravity or altered gravity. So Allie has on some shorts that she's going to wear while she steps into the treadmill. So go ahead and step in, Allie. And then we're going to adjust this piece up so it's at waist height for her. And then lock it into place. So then from here, we're going to zip in the skirt. This part takes just a second. And then the next thing from here is this treadmill is going to fill with air and weigh Allie. So I'm going to have Allie press the start button, and you'll see this fill with air. Right across your chest. Perfect. So then it gets her weight, and we're going to put it at a different percent of her body weight while she locks and runs in it. And then we can see the percent, and then it'll adjust how much air is in there to support the different amounts of weight for what we want to set her at. So it's almost got her weight here. We always have to be patient. Perfect. So now she has it set, and we can set it at a percentage. So we're going to go to 50% to start with. So we just adjust the buttons here. And that means Allie is going to be walking at 50%, and you can adjust the speed there. 50% of Allie's body weight is supported by air, and then she's only using 50%. So it'll feel like she's walking on her toes here right now, and we can adjust it as needed. We use this for patients who have had knee injuries, ankle or hip injuries. We can use it for patients who have had strokes or different types of neurologic impairments to get them moving, running, and walking better. So then she can go for as long as she wants in here. And that is an example of our Alter G.
Yep.
All right. So hi, I'm Allie. I'm a physical therapist at OHSU, and this is Sarah. She's another physical therapist. Today I'm going to talk a little bit about the Balance Master. So this is a piece of equipment that we have here that can help us with assessments and help us with treatments for people who have any problems with dizziness or problems with their balance. So today I'm going to show you one easy assessment that we can do with this machine. Our balance systems are controlled by three main things: our eyes, our inner ear, and the feeling we have in our feet and in our joints. This thing I'm going to show you today can help us differentiate which of those systems are strong and which of those systems we want to work on a little bit. So I'll have Sarah step in on the machine here. I'm going to find her ankle bones and make sure that they're just lined up in the right place. Looks good, Sarah. And then I'm going to turn on the machine here. Okay, so what Sarah's going to do is she's going to stand here for the different conditions. And sometimes the platform she's standing on will rock, and sometimes the sides will rock. So I'll just show you the two most exciting conditions here. All right, Sarah, so what you're gonna do is cross your arms, keep your eyes open, and try to stand as steady as you can. All right, stand quietly with your eyes open. So it's gonna start testing. Sarah's balance is really good, so not much is happening with the machine here. She's gonna stand here for just a couple more seconds. And then when the results pop up, they're gonna show us where she scores based on her age match norm. So for that trial, she's really high. Now we'll do the most exciting one here, so you can hopefully see some things move. All right, Sarah, keep your eyes open. Stand quietly with your eyes open. All right, now you can see the machine's moving here a little bit, so it's trying to trick Sarah and make sure her balance systems can keep up. The platform she's standing on is swaying a little bit too in reaction to how she's moving. So if she's standing really still, nothing should be happening. So you can see on this one, let's see how Sarah did. She did pretty good. She was right in line with her age match norm. So if we did all of these different things, the computer would spit out an algorithm to see how strong her different balance systems were. Go.
So when we have a patient who's an athlete and wants to return to sport after a knee injury or a hip surgery, we often will go through a series of tests to make sure that surgery site and non-surgery site are the same. So this is one test that Ali is going to show you today, and it's called the Y balance test. So in order to do this, she's going to stand on the platform with one leg, and she's going to go through a series of squats, sliding these out. So go ahead and do the test, Ali. And while Ali is doing this test, we want to make sure that she keeps good form, that her hips stay level, she keeps a good alignment in her knee, and that she keeps her trunk up nice and tall, and she reaches in 3 different directions. Well, we would have to do that 3 times on each side. We'll just show you the one for today. Ready? Perfect. So, for another test we'll do for return to sport for patients is a series of jumps. So Ali is going to show you 4 different jumps that we do to look at for return to sport. Again, when we do these both sides, we need good form, symmetry for her to stick the landing. So for the first one, she does a jump on one leg as far as she can. Good. We would have her do that 3 to 4 times, take the average and compare to the other side. The next test she'll do is 3 jumps consecutively in a row to go as far as she can for distance. Perfect. The following test would be a crossover jump. So she'll jump from the inside to the outside to the inside of a line. And we'll use the imaginary line on the floor here where it changes color as her example. Good. And then she sticks that last one perfect. And then for the last test, we would have a 6-meter line, which we don't have on the floor here, but she would go as quick as she can, doing hops all the way down that line for time. So go ahead and start. Perfect. And that would be our test. We would have her do that on both sides. You want her within 5% side to side. Tell her she can go back Thank you for watching those videos. Hopefully you enjoyed them and learned a little bit about what physical therapy is. A little bit more information on the course to get to physical therapy is that before physical therapy school, you need to complete a bachelor's degree. The bachelor's degree can be in any topic or subject. Many of my classmates when I was in school had accounting and journalism degrees. They just had to complete the required prerequisites, usually consisting of chemistry, physics, biology, anatomy, and some other different courses depending on the school. So you can take any course you want to get to therapy school, and you can go at any age too. Some of the people in my class were fresh out of undergraduate school at 22. Others were pursuing a second career at over 35. Once you've completed your bachelor's degree, it's a 3-year doctorate program to then become a physical therapist. After that, there's a variety of different careers you can get in physical therapy, including pediatrics, orthopedics, neurologic, working in a hospital, a private clinic, or a skilled nursing facility. So the options are endless for what you can do. So hopefully physical therapy is something that piques your interest and you'll look further into. Thank you.